was a resolution in the World Health Organization in 2005, which really was just a call to try and increase political commitment, specifically on these issues. That if we're really concerned about ensuring people get the services they need, and that they also have some financial protection when they access those services, there needs to be far greater commitment, not only political commitment, but financial commitment. Now, don't be scared about this box. When we talk about universal coverage, what do we mean? There are many lower income countries which would say we have universal countries. It's actually not something which is easy to measure. In Catalonia, do you have universal coverage? I would say yes. Many Catalans may say no because of the waiting lists and so on. We tend to think of coverage in terms of three dimensions. Okay? One is in terms of the population, which is covered. The second is in terms of the services, which are covered. Excuse me. And the third dimension relates to the financial protection. What percentage of the cost of those services is covered? And what you get in many countries is that governments say, well, okay, we know we cannot afford to fund everything, but we focus on some essential package of services, which maybe is represented by the blue box. And it raises some interesting questions that maybe not the whole population is covered, depends on the country. But if that government gets more money, domestically or through external sources, how to spend it? Should you spend it in terms of extending the population coverage? Or should you say, okay, we don't change the scope of services, but people are having to pay some money now themselves, let's try and reduce this amount? Or do we say, well, actually the priority is that the services we're covering are quite limited, we really need to expand the scope of these services? There's no answer here, there's no right answer. But when we talk about coverage, these are the types of issues that we consider. I worked also for 4 years in the Philippines. Thanks. The Philippines has a social health insurance system. At the moment, around 53% of Filipinos are in this system. Of those 53%, only 22% are actually using services. Many people have the insurance card, but they don't live anywhere near a facility. They still have to spend some money. And of these 22, you basically effectively have many people who are still paying a lot of money and having financial problems. This is a report which was conducted, which shows that even though, the point here is that even though 53% of Filipinos have insurance coverage, only 8% are effectively getting the services they need without having to pay large amounts of money. So this term, effective coverage, so we have to dig a little bit deeper. It's not only about giving someone an insurance card, for example. As I said, I'm not an expert on India, but this is a presentation I saw last week. Actually, I didn't see it, but I was at a conference and I got the presentation from the author. There is a new national program. This is the name. I won't try and read it. In India, I think it was launched in 2007. It's a government-subsidized insurance program. 3/4 of the money comes from national government, 1/4 from the state governments, and there are some benefits provided in terms of the cost of hospitalisation. I won't read through all this, but this has been quite a large program which has been pushed in the last 3-4 years in India. Again, this is some information on the coverage, the number of people enrolled, number of people who have benefited, and so on. So I think this has been a major national initiative to try and improve access, this box, to try and improve the financial protection, in particular, of health services for Indians. And there's quite a large geographical spread now. Just very quickly, there is a focus here on external funding for the health sector. India maybe is not a good example. I mean, less than 2% of funding for the health sector comes from external sources. So the kind of issues which come up in Moçmabic or Bangladesh or Cambodia are maybe not so relevant in India. Okay, this is my last slide. In the World Health Report, this is actually chart is taken from a presentation put together in Geneva. So I will read through a couple of the points made in that report, that there's still an urgent need for both more funding from international community to help poorer countries, but as always, this predictability. So more predictability is in some ways just as important as the amount of money. If it's the amount that's committed or actually transferred varies significantly from year to year, it's very difficult for the government to plan and give guarantees, effective guarantees to its population. Okay, and the final bullets here really are echoing existing issues raised in the Paris Declaration, for example, around harmonisation both between donors or international agencies and between international agencies and domestic governments. We'll hear more about that, I think, in the next presentation. So that's all I have to say. I've just tried to give a flavour of some of the issues we tackle in the health financing team with World Health Organization, with a bit of data thrown in for India. So thank you very much for listening.